One nurse says she was passing by my room and my room door was slightly open. Saw me like jerking, like literally having a seizure. And she ran in and she called all the nurses, checked my BP. It was like 250 over. It was a bit of a lot. That made me go back to ICU. Hi everyone, my name is Rixongile Ngobeni. I am 26 years of age, turning 27 very soon, and I'm from Giyani. Giyani is in Limpopo, it's a small town. I'm Tonga, and I grew up in a very Christian home, a very, very Christian home. I am the firstborn of 2 siblings, so I have a sister, a younger sister, and my mom passed away when I was a bit young. She passed away due to some chronic illness, and I think my sister was 6, I was 8, if not mistaken, and my dad just literally took care of us, and my paternal grandmother. She's been the one that was like literally hands-on in terms of taking care of us. And my childhood wasn't as dramatic. I think it only got a bit dramatic when I was in high school. And when I was in high school, I think in grade 8 or grade 9, if not mistaken, I would just fall and collapse, you know, at school. So every time I would collapse, my dad would have to be called in. He would have to come take me to the doctor and things like that. So in most cases, when he would come, he had to figure out, like, where do we go? Because, you know, we've been going to one doctor, like one after another, and you're thinking, I think maybe it's the doctor that's a problem. And this was like recurring like a lot. And I do think it did play a role in terms of my education. Although I didn't allow it to disturb me, it did play a role. So I ended up going to quite a number of specialists, 2 of the diagnoses that I got. And the first one was epilepsy. The doctor said that I was epileptic because of the brain rhythm that was going on in my head, and then I was on pills. So I would take epileptic pills for a bit of time, and then the other was with regards to my heart as well. So I had to do quite a number of things in order for me to basically get better. And I remember I was at church and we had a camp, a prayer camp, and it was all girls, like it was just a girls' camp. What we would do is we would fast for like 3 days, and we would all be sleeping in church. And as that happened, basically, I was like, okay, today it must happen, you know, because I'm thinking about all the issues that I'm going through and every single thing that is a bit of a problem for me. And on that particular day, according to what has been narrated to me, apparently I just literally dropped. And everyone was just praying and praying and praying and praying for like plus minus 6 to 8 hours. Apparently my legs were cold as well. They didn't even think I was going to live. Like they almost thought I was not alive. But God is good. Recently, in 2021, it's 2022 now. In 2021, I had a very, 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 very sad and a very traumatic experience. I started my period and I was in high school, and at that time when I started my period, having everyone in school saying to me, if you have period pains, it's normal, you know, having to tell my dad. Sometimes I'd have to tell him I'm not going to school and he'd be like, period pains, who does not go to school because of period pains, you know? So I would end up having to go, but at the same time be in so much pain. So I ended up getting used to the pain and getting used to actually treating it. Especially when I went to varsity, I started realizing the fact that it was getting worse. And by worse, I mean I could not just take one pill. I had to take like 2 pills in the morning, 2 pills in the afternoon, 2 pills in the evening, you know. So I ended up doing that, and they got so bad, like in varsity, they got so bad to a point where when I was having my periods, like I could not go to school. Like class was an automatic bunking. Even with the pain that was going on, I decided, you know what, let me go to the doctor. And this was last year, taking back to last year, in Jan, I decided let me go to a GP. Although I had been going to GPs and they'd give me painkillers or prescribe some, you know, period pain pills, it was definitely not the same. So I went to the GP and I was in pain, like I was in excruciating pain. And I do remember saying, okay, I really honestly need to get it checked. I did think of going to a gynae, but I had never actually done it. I was like, no, I don't need a gynae, it's not that bad now, so let me go to a GP. And when I went to the GP, he looked at me and he was like, yo, you look like you're in so much pain. You look like you are wishing, like it's a lot. And I think I would be doing an injustice if I did not give you a referral letter to go see a gynae. I thought gynaes were for people who are pregnant and wanted to get kids, you know. I do know it sometimes might seem very ignorant. I didn't even know the difference between so many specialties when it comes to doctors. I don't want to lie to you, I didn't really do as much research with regards to the gynae. However, because of the hospital that the gynae was in, I was very comfortable. This was in Netcare Waterfall, so I was like, you know what? I think because of where the hospital is and how the hospital is known, I do know they have very reputable doctors, and I felt like that would be more than enough for me to choose a doctor, and of which I did. And I went to the appointment. I think it was after a week of me going to the GP. And then on my first appointment, I got there and I knocked on the door of the gynae, and I got in and she was like, what's wrong? And I'm like, my stomach. So she said, let's go and check. And we went to the room, she checked me. And before she checked me, she said, she asked with regards to the pain of the period pains, are they painful? And I said, yes. Do you have a heavy flow? And I said, yes. Do you have a weird discharge? And I said, I haven't realized that. Pain during intercourse, I wasn't sure. What else? I'm not so sure about the last one, but she asked me quite a number of things, and she ended up saying it might be endometriosis, but let's just see when we get there. So she did the procedure, she scanned me, and she's like, oh my gosh, I didn't expect to see this because you're actually very young. She asked me my age again, I told her again, and she said, I'm sorry my dear, but you have a fibroid. And I was like, fibroid? So number one, I knew what a fibroid was, but I didn't know what a fibroid was. And I realized after she explained, she said, in most cases when people come into her room and they have fibroids, it's usually at a position where they are plus minus 30 and above, 30 years of age and above. And it's less likely for people that are 30 years, yes, but it does happen to younger people, but it's not as frequent. And she said it's quite big, it's very big, and I think if I can remember the diameter, she said it's slightly bigger than a grapefruit. So that she says that was what was actually causing the pain. And she said because of how big it actually is, I don't see another option but to operate on you. I think if I can remember the centimeters, I think it was above 10 centimeters. I think, yeah. So she said I have to operate on you, and how I do it. So she basically operates on a particular once or twice in the week. So she operates once in another hospital and operates once in another hospital. She said it wasn't going to be much of a bad surgery, but she did mention the fact that I was going to have to stay for plus minus a month and a half to recover. And I said, okay. In my head, I felt like it was okay because it was Jan and it was the perfect time for me to be doing this and be recovering in order for me to go back to, running my businesses and trying to figure out life basically because the year had started. She called me in the middle of the week and she said to me, the medical aid does not pay for that particular hospital. It pays for another hospital, which she also works in, which was great. It was in Glen Austin, Castanhoff. And she said, you'd rather maybe go there so the medical aid can pay like 100% there. I remember on a Friday, before I needed to get the surgery, I had to get a COVID test. So she wrote a letter for me. I went to the blood company and I took blood. I went to go take the swab. And I remember on a Sunday, and I was sleeping at home, on a Sunday, like a message comes in and it says, you are COVID positive. And I'm like, like in Jan, how am I COVID positive? And when I saw that, now I had to quarantine, and the problem then was I can't have the operation because I have to quarantine. And she said to me, please just wait for like 14 days max, and then after go and test again so we can do the surgery, and which I did. And then after 14 days, I think I waited for 16 days. After the 16th day, I went back to the lab and I did the swab again. After doing the swab again, after a day or so, I got us an SMS again, COVID positive. And I'm like, no, must be something. And I remember telling my sister, what if it's a sign? What if it's a sign that I shouldn't do all these things? And at that time, I wasn't really worried because I was like, okay, maybe it's a false positive, maybe it's still in my system. Like she said as well, she said it might still be in your system, but you don't really have it, especially if you don't have any effects of it. And I said, it's fine. And then what happened then became, I stayed for another 10 days. And then after 10 days, I went back to go and check again. And I took the swab and it came back positive, literally for the third time. And I'm like, what's going on? And I remember going for the fourth time and they said, okay, perfect. You are now COVID negative. And I was like, great. So I told my doctor and she booked me in for the surgery. I remember the day before the surgery, I think it was on a Monday, the day before the surgery, I had my periods. Actually, let me just say, the days leading to my surgery, I had my periods, and they were the worst I've ever experienced in my life. Another thing I forgot to mention was my belly started like getting big. It was quite big, and the reason why I didn't really take it into consideration was because it was locked down, and I thought, it's because I'm not walking around, I'm not being active, and I'm eating right through, so it's probably because I've gained weight. But as I went and after she told me, I realized actually it looked like I was pregnant, and it was pretty much because of the fibroid. So that's what made sense. But on that particular day before I went to the hospital, it was bad, guys. Like I had such huge clots of blood coming out of my, as I went for my period, and I had never seen that. I literally had to take a picture of it because I was like, this is a bit too much now. And basically, that was what was like, you are going there tomorrow, you're not changing your mind regardless of what whoever says, you are going there. And I went there the next day, I checked myself in, and I was booked for the surgery. So I got in to theater. She explained to me what was going to happen, and after explaining it to me, I told her I was having my periods, like it just pretty much ended maybe the day before. Is it going to be a problem? And she said, no, it's definitely not going to be a problem. And I said, okay. And I remember them wheeling me in, and they put in that, and I'm gone. I'm completely gone. And after that, the only thing I remember was me waking up in my bed, in my room, and trying to figure out what was going on because I was in so much pain. I understood that I was supposed to be in pain, but that one was, I don't know. The problem was I couldn't compare the pain because I had never had a surgery, but it was just too much. So apparently I woke up and I just started screaming at everyone. I do remember having a lot of nurses like just surrounding my bed and trying to figure out what the problem was. And I do remember the lady, one of the nurses, saying, let me give you this one. It's going to help you. I know it's going to help you, you know. And she gave me the injection, and it really did help. But at that time, they were calling my gynae to come and figure out what was going on. And they checked for my bloods, and that was where the red flag was. Everything, guys, was bad. It was just bad. The only one thing I can remember that I still feel like, what? This was after I was looking at my test results, was my CRP. I hope that's what it's called. It's an inflammatory rate. It's supposed to be less than 5. It was like 130 something. And I'm like, there's no way. I'm trying to figure out how I lived out of it. I do remember not having as much blood, so I do remember having quite a number of blood transfusions. There were quite a number of bags. And she came in, she tried to explain, I wasn't hearing her, and she said to me, I have to go and check for what's going on with regards to, I need to go to the sauna. I went to the sauna, they checked, and they didn't tell me anything, but she came in, I think that evening or the next day in the evening, she came in with her scrubs and she said, we're going to theater immediately. And I'm like, why are we going to theater? Like, I'm trying to understand what's going on. And she said to me, I'm going to theater because the pain that I'm feeling does not make sense. And they checked the test and they realized I'm bleeding internally. And I was like, sure, okay. At that particular time, guys, like my mind is not there completely at all. All I'm feeling is I've never felt the way I feel. I'm alone in this hospital. My family can't come because it's COVID season. And I'm like, okay, it's fine. So we went back to theater and they did what they did. And I do remember her saying after that she was telling another doctor, and she said she's in a very delicate condition. She's going straight to ICU, you know. And in my head, I'm thinking, ICU, is it a big deal? Is it not a big deal? But I was like, God, as long as I live. And I remember after the theater visit, the second one on that particular day, I went to ICU, and when I woke up from ICU, I see someone. I wasn't even sure. I see someone sitting behind a glass. And they're literally just sitting looking at me, and they're machines that are literally all over me. And I'm trying to figure out what is going on. Am I dying or am I dead? And it's a dream. Like, I'm trying to figure out what's happening. And I just screamed. They explained to me what happened, and they explained to me I'm going to be okay. And I said, it's fine. I stayed in ICU for quite a few weeks. I'm not so sure. I think 2-3 weeks. And during my stay in ICU, I do remember having to also go through for a number of surgeries before, but I also do remember having to go for a procedure at that particular time when I was in ICU. And this was because one day when I was in ICU, my gynae came in and she said, you look like you're doing well, you know, and I said yes. And she was like, but I have an issue with your breathing. You're not breathing properly. I don't think this is how you're supposed to be breathing. So we need to try and figure out what's wrong. And I said, okay. And that's basically what happened. They tried to figure out what happened. This was when I also then started getting a physician come and see me, best physician. So he came to see me, and he was just like, you know when someone looks at you from afar, and I'm like, yo, yeah, you know your work, and he's like, yeah, it's a pleural effusion. In my head, I'm like, I don't even know what that is. And for your information, a pleural effusion is when you have water in your lungs. And basically, apparently what causes it is when your body is in so much pain, the first organs to react are your lungs. So in most cases, when you are in pain, your lungs will react. So he said, it's not a big thing. You're just going to sit there. So apparently they had to cut the side of my side. And depending on which lung it was, they cut my side, they put in a tube, and they literally put me upside down, and they put in a tube, and they just drain the water out into a bag. And then they take the bag, and then they go and test it to see what could have caused the pleural effusion and if it needs to worry us or anything. I then had to go to the normal ward because at that particular time I was getting better, okay? And mind I say, I could not, when I was in ICU, I remember that was the worst time of my life, like my entire life or my entire existence. I couldn't eat by myself. I couldn't hold my phone for like 30 seconds and not feel like it's such a duty. I couldn't talk to my family or friends for more than a minute and feel like it's a lot. I couldn't wash myself. I had to literally be washed. I couldn't pick myself up, so the nurses would have to be like, it would be two nurses on the top and on my feet, and they would carry me, and they would, on the side, like you do a baby, they would put me to the side and they would clean my back, put me to the other side, and literally like I was a baby. I also had a catheter, so I didn't have to move around. I do remember having to poop in such a, it's this small tub, they bring it there, you go up, you sit, and you just poop and they take it away. And I was just like, I don't even see these things in movies. I wish I knew what I was setting myself to. And after that, I started getting better. I started walking as well. I had a physiotherapist that came to start teaching me how to walk. I could not walk. It took me so long for me to be able to walk again. It felt like I was never able to walk, and I was a kid that needed to be taught all these things all over again. And as I was making progress, they took me to the general ward again as means to basically prepare me to go home, pretty much. And when I got there, I remember I stayed there for like a day or two. And after staying there for like a day or two, I do remember on the second day, I don't know what happened, but this is what has been explained to me by the nurses. One nurse says she was passing by my room, and my room door was slightly open, and I was sleeping next to the room door. And when she passed by, she saw me like jerking, like literally having a seizure. And she ran in and she called all the nurses. According to her, they checked my BP. It was like 250 over. It was a bit of a lot, so that made me go back to ICU. And I went to ICU for a couple of days, I think, if not a week. And after that, I started getting better, but the breathing was also still a bit of a problem. We didn't really take it into consideration because at least I could do the amount of things that I wasn't able to do at that particular time. So after a week, I went back to the normal ward, and I was then discharged after 2 days or so. When I was discharged, this was in March. Yeah, this was in March. I was discharged and I got home literally just for 1 day. I got home, I was excited. My sister gave me these welcome balloons and I'm like, I'm here to stay, I forgot to mention, I'm sorry, when I was in ICU, they put in a BP thing here. So when they put in a BP thing, it counts your BP for like every 30 minutes, if not mistaken, for the whole day. So it does that every 30 minutes, you don't take it off. And when I took it off, before I left, to a certain extent, I had like bruises. I didn't know that was a problem. So I had bruises, but I didn't know why that was. So I just let it be. I went home, got the welcome, I slept on that particular day, and the next day when I woke up, my sister made me breakfast. After making me breakfast, I was trying to sleep I was taking a nap for the afternoon, and I was just like, I can't sleep. Like my chest was just hitting so hard. I didn't understand what was going on. And then I called my sister and told her, take me to the hospital again, like just take me to the hospital. And that's basically what she did. When she got there, we got to the hospital, I went to casualty. And I explained my problem with regards to my breathing and how my heart is beating. And I remember the doctor saying, let's do some tests, maybe it's your iron or maybe, and he did everything. And he said, I don't see a problem with you. And I'm like, I really have a problem and I'm afraid to go home because it's so bad, He gave me this drip in order for me to for the pain to be better. But I do remember saying to him, can you please call my physician and tell him I'm here, because I was here yesterday and I had a surgery, so I'm trying to recover from that. So he did that, and he called my physician. My physician advised him to do a test called a D-dimer. A D-dimer is basically a blood test that checks the how thin your blood is. If you have a blood clot, it can possibly show such effects. So when the D-dimer came back, it was very high, and if it's high, it means you probably have a clot. So to confirm if you have a clot, what needs to be done is you need to then go and get a CT scan of your lungs. Clot is when your blood clots within I don't know if it's a nerve or where it passes, basically, it can't pass. So because it can't pass, you are unable to pretty much breathe. When I woke up and stood up and went to the toilet, I saw blood coming out from my legs, like a lot of blood coming out from my legs. And then I called the nurse and I asked, what's going on? I don't know where the blood is coming from, because I'm definitely not on my period. And they checked and they realized it might be because of the blood thinning, because I had just started. But at the same time, another problem was my stomach now developed something called a I'm not so sure. It had clots. My wound had clots within it, so the blood was a rock, sort of. So it had to be cleaned, which meant I had to go back to theatre, which then makes it the fourth procedure, if not mistaken. So I went back to theatre with a surgeon, very good one, and I went back to theatre, and he said to me he was going to reopen the wound that I literally took like 3 to 4 weeks trying to recover from. He will reopen it and he will try and clean it. And then after cleaning it, he will put a bandage, but he'll put me on a machine for people, like a wound clinic kind of thing. So the machine will be pumping out whatever dirt and pus that needs to be pumped out. And then after the machine is done, it will slowly close the wound itself. So I don't have to, he doesn't have to literally close it. It will close itself as it cleans the place. And I said, okay, that's fine. So that's what I did. And I do remember at that particular time, after that surgery, I do remember going to ICU. I'm not so sure what was the problem, but I do remember staying for like a week or 2 in ICU again. So this was the 3rd time I was in ICU, having to see so much blood coming out of me after I think it was 2 days of having the machine inside of me. After the 2nd day, it literally just, like, blood literally just came out. I don't know what was going on, and I had to go for another procedure in order for them to rather discard the machine and close the wound itself, which then was what happened, which is the 5th one. They discarded the wound, the machine, and then they took me to theatre to go and runga again, basically. After that 5th one, I left and I went home, and I was told, obviously, because of the warfarin and because I was taking blood thinners, I had to take them for 6 months. And I also, because they were in both lungs, I had to take them for 6 months, and I also had to make sure I had checkups every single day until I get used to it. When I came back from the hospital on that particular day, they had cleaned my wound, and after cleaning my wound, they put in a band-aid and I went back home. But as we're doing these errands, I realized that my band-aid had pus. It had pus, and I'm thinking, what is coming out of here? Because it was okay when I left the hospital today. And I decided after the INR that I'd go to casualty at Netcare Hospital at Waterfall in order for me to go and see what's happening. When I got there to casualty, they were like, babe, you have such bad sepsis. This is bad sepsis. People die because of this. And if you had not come now, it would have been a bit of a problem because it can spread throughout your whole body and be very toxic. And I was like, okay, I didn't know it was that deep. So they had to admit me. Another reason why they allowed to admit me was because apparently they do not allow to admit for you to change hospitals if you've just had a surgery. I didn't know that, but they allowed because the surgeon that was treating me was in both hospitals. I ended up being admitted. Guess what? Before I get in for the admission, they need to check for the COVID test. And guess what the test was? It was positive. It was positive, and I'm thinking, I'm from a hospital. How do I have COVID from a COVID-free hospital? And I didn't have a choice but to go to the COVID ward in that hospital. So clearly I got the COVID from the other hospital, which is Castelloff. I got the COVID there. And I was so mad because I'm thinking to myself, I personally as well, I wasn't really taking care of myself with regards to putting on a mask when I'm there, because you're not even thinking about putting on a mask the whole time when you're sleeping. But I do remember a time where a nurse came and said she had like a bit of a flu, you know, and I didn't really take it seriously because in my head I'm like, no, I've been immune for 3 months, so I still have time, I'm not going to get this thing. Unfortunately, I did. And like I said, I didn't have any side effects, which was great, but I had to stay in hospital for 15 days for the sepsis, the wound, and after 15 days, I went home. I was discharged, I went back home. And this time, before I went back home, they removed the sepsis using the wound clinic machine. And then I went home. After going home, I stayed for like 2 weeks. Yes, I stayed for 2 weeks, and then I started having cramps again in my stomach, which made me go back to my physician, and I told him, I'm not okay, there's a problem. And he said to me, what's going on? Let's do the tests. We did a CT scan only to find that I had a partial bowel obstruction. And I'm like, can it not get any worse? I don't even know how many diagnoses I've even had. And in my head, I'm like, all these things I've never heard of. It's the first time I hear of these things on my body, you know. And he said I had a partial bowel obstruction. It might be highly possible that I may have to go for surgery, but he'll try as much enema as he can before I actually go for surgery, but I'll have to sleep there. And I was admitted to hospital. He did. I came back in the morning. I was admitted. I stayed for quite some time. He gave me the enemas. Thank God the enemas worked. I literally pooped like I've never in my life. And after that, I do remember on the first night of me actually pooping, I realized that my hands were blue, sort of. They were turning blue. And I do, at that particular time, because I was taking warfarin, I had an idea of what it could be. So, but I wasn't sure. So I tell the nurse and I say, my hands have changed color. They're blue and I'm not understanding. She looked at them and she's like, maybe it's because of the oxygen. She came with the machine. She checked the oxygen. It's not the oxygen. And she was like, okay, your physician says, let's check the INR. They checked the INR, number one. My INR is not supposed to be more than 3, because if it's more than 3, that means I am more likely to bleed literally anywhere. That is how dangerous the medication is, only to find that my INR was at 8. And my physician was like, I'm trying to figure out what's going on with your life, but you're literally having the worst complications every single time. That's what happened. He gave me vitamin K for it to reverse, which was good because it's warfarin. And then after that, I went back home. I didn't have to get the surgery because the partial obstruction literally just sorted it out on its own. And then I went back home. I went back home for plus minus a month. After a month of being at home, I came back. I was in pain, guys. I was in pain in my stomach, and I was trying to figure out what's going on. So I started by going to my surgeon, and he checked me. He's like, no, use this medication, let's see if it's gonna work. I think after 2 days I was just like, I'm dying. I went to my my gynae at that time, and she said to me she doesn't know what's going on because she's checking, but there's a cyst, and this cyst is not supposed to be causing this much pain, because she saw the cyst, you know, and she's like, she doesn't understand what's going on. And I said, okay. I went to go get the CT scan for them to see what was going on. I do remember reading the CT scan, and it was like, my colon is inflamed, which meant I could possibly have colitis. And colitis is a condition that usually happens to white people. Number one. Number two, it's very hereditary. And I'm thinking to myself, I've never heard the word colitis. God, what's going on, you know? And I do remember also having to go to surgery. This was basically my last one. My gynae and my surgeon then decided to take me to surgery, again to theatre, to go and do sort of like an exploratory thing. And this was my 7th time having a procedure. And this was pretty much in like 4 months, if not mistaken. 4 or 5 months. And I was like, okay, I just wanted to have everything done. I went in and they did the exploratory thing. And when I came out, it was way better because at least, okay, initially I forgot to mention the surgery that I got initially to remove the fibroids was called a myomectomy. So myomectomy was basically them cutting literally like I'm giving birth to someone. So I have a very big scar here, and it took a bit of time to heal. But this time when they were doing the exploratory, they did a laparoscopic, which is them putting incisions, small incisions in my stomach, and then putting so like those, you know, and using them to clean. And basically after that, they gave me a report back saying the reason why I was having pain was because the pus, remember the pus that I assumed was out? Apparently it was not completely out, and that might be the pain, which was good because at least I came at a good time. The second thing was because I had a hemorrhage on my wound. So it was a hemorrhagic cyst, which was a bit of a problem because if it ruptures, it was also going to be a problem. So they dealt with that as well. And the third thing was because of something called adhesions. And initially when they explained to me, I didn't know what it was, honestly, but now I'm saying adhesions because I really need to emphasize on it. So basically this is when all your organs like sort of like stick to one another as they heal, because as they heal you get a scar. Outside you get a scar, but inside your healing kind of scar is basically adhesions, like kichepisi, so in your stomach. So everything was also like clamped together according to him. So that could have also been the reason why I had constipation issues. I sometimes had diarrhea. My stomach was sore. It's because all these organs were literally just fumbling, you know, everywhere. And I was very grateful. I don't want to lie. One thing I realized with regards to all that has happened was I was so grateful that every single surgery I went to, I came out. Hi, my name is Rixongile Ngobeni, and I have been through the most.